At work.
You're at work. Okay. And where, like, don't tell me the hospital, but like, you're in New York, aren't you?
Uh, North of New York City, like right outside
Okay.
of it.
Okay, cool. And how are you seeing a lot of cases of corona right now?
Yeah.
Yeah.
The ICUs are all full and the floors are starting to fill up. New York City is getting hit a little bit worse this week, so I think
Okay.
their answers will be considerably worse.
Yeah, yeah. And how much has it been like in the progression of like everything that's been happening? How has this week and last week compared to the last couple months?
So the area I am in was
Hmm.
much worse like 4 weeks ago,
Hmm.
but it's leveling out in the last week. But we anticipate another big surge coming in the next 10 days.
How
So we're
come?
sorry,
How come? Why is that?
because full restrictions haven't been followed, and we
Mhm.
think people have been moving around a little bit and spreading it, and it usually takes about like 10 to 14 days for people to like get sick enough where they will go to the ER,
Okay.
and that's going to happen right around like next week for us.
What was surprising for you with this whole thing? Was anything like shocking? Because I know there's a lot of thinking misinformation out there about like what this actually is. Because I remember when this was first like when we first started to see it, it was a lot of like, oh, it's just kind of like a bad flu, or young people can't get it really bad,
That
and
one, that last one.
okay.
Well,
Hmm.
young people do fine. I think their like death rate is pretty low, but they
Hmm.
do get quite sick. They do get in the hospital. They do end up in the ICU. They do end up on the ventilator. Um, but young people that also have high viral load exposure, like healthcare professionals or like a principal died in Brooklyn who was 36, and I think she was probably around lots of kids and lots of people. So when you're exposed repeatedly, and I think as a young person you socialize more, so
Hmm.
you're just around more people that might be infected. So that may be why young people have worse outcomes or are getting sick.
Hmm. And what about like the asymptomatic people? Like when people say, oh, some people are asymptomatic and they have it, what does that mean?
That means you have it, are not feeling bad at all, think you feel great, and are walking around infecting everyone around you.
Hmm. And does it eventually hit you, or can some people just be carriers of it and just continually like not have any symptoms the whole time?
Both,
Okay.
both. Um, so a lot of people that don't have like classic symptoms, one symptom they have talked about a lot is loss of smell and taste.
Oh, wow.
Yeah.
Okay. Okay. And what are some like milder symptoms that people might be thinking, oh, this is just allergies or I'm just tired or something? Like
Runny
what would
nose. Some people have a postnasal drip when they wake up in the morning, and the back of the throat is a bit sore, sore throat, like a little bit of a cough. Like every time I cough now, I panic. Like,
wow. Wow. And how are you guys protecting yourselves? Because now we're saying that there's so many things about not having enough PPE and not, everyone we're going to be running out of equipment for the healthcare providers. Are you guys
yeah,
seeing that?
I think that'll happen. It's happening in some places, especially like city hospitals and places that are not well funded.
Mhm.
My department is really good. They've been taking care of us. They've been advanced stocking up, so we're doing much better, I think, compared to the average. But even that, I think, will drop off as the real, because the most people are expecting the peak in New York City to be in 2 weeks, and it's
Okay.
already really bad. So I think in the next 2 weeks, supplies will really dwindle. I've bought myself like two like full on like gas masks basically just in case, because like if supplies run out, I want to protect myself.
Yeah, yeah. And how does it feel going to work every day? Like, how are you scared? Are you stressed? Like, what's going on in your world as you're walking into the hospital every day?
I'm pretty scared when I walk in, but then I just tell myself to not think about it, and then it's you know because if you think about it and you just realize that you're in a building full of people that have this and that like it can survive up to like 3 days, and then you realize the entire building probably is covered in it, the elevator is probably covered in it, everything is covered in it. So like what's the point of even wearing gloves or masks? But then you can just like wallow in a hole of anxiety, which is not productive as well. So I just like not, wear my mask, wash my hands, and that's really all I can do.
Mm-hmm. And then when you go home, are you around people, or like are you around your family? How do you keep other people?
I live alone.
Okay.
But even then, I've cut off physical contact with my family because I don't want to get my mom or dad sick. They're older. They're high risk for a bad outcome.
Mm-hmm.
So I told my mom, like, don't expect to see me maybe till summer.
Wow. And so how how long do you think, like, I know that obviously it's really hard to predict with this, but how long do you think, based on what you're saying, how long do you think this is going to be happening to this extent? Like, because I know you guys, the Middle East,
that's really,
yeah, go ahead.
That's a tough question. There's a lot of variables at play. I think the ultimate thing we're waiting on is a vaccine or antiviral treatment.
Mm-hmm.
Whenever that comes, that'll be like the real drop. In between, I think we're going to have like little waves, but then this new data came out like in the last 48 hours where they did a study of the cruise ship in Japan. Mm-hmm. That was like anchored off for like a month while they tested everyone. And it's a really good experiment because basically a cruise ship is it's like a closed system. No one leaves and no one goes out or in. And what they found, which was really interesting, I'll just cut through all the numbers, but there's a strong suggestion that a lot of people that were asymptomatic developed immunity really fast.
Oh, wow.
On the cruise ship, which is good because what that means is if you were to open up the cruise ship and let like more people in with infections, they wouldn't reinfect everyone in the cruise ship. They'd only infect a few people. The rest of the people would be immune. If that holds for society writ large, I think, I'm really hoping that holds true. But what that'll mean is the second and third waves won't be that bad.
And what do you mean by like can you talk a little bit about like second and third wave, like for people that don't understand what that means? Like, what is the whole idea around it?
So basically, they're locking everyone down in Tel Aviv, so no one will get the disease. But then the disease doesn't go away. It's still like in some people, in some pockets, you don't really know. And in the moment they let you back on the subway again, the few people that are still carrying will infect other people. But those people were never infected in the first place because they were home, so they never developed immunity. So those people will get sick again, and then there'll be a massive spike in cases, and then the authorities in Tel Aviv will have to shut everyone down again, and then everyone will go back home and try to like preserve it for the health system. And then a few weeks later, we'll come back out only to repeat the cycle. And the problem with that is that you have repeated waves of infection because no one's developing immunity.
Okay.
And I think in like rich societies like America, Israel, Northern Europe, the authorities can afford to pay people and help them, survive the economic damage of like going home over and over again. But in other countries, you're not going to have that.
Right. And go on.
So I think that's like going to be a huge test for the next like 2 months worldwide is what do you do with these people? Yeah. So I think they might just let it go and let people develop immunity and like pay the price. I think that's an approach that some countries will take. So I don't know.
Mm-hmm. And with you guys, like I know it's interesting because with us, we're a small country. Everyone is following the regulations and the rules and everything. And I know with the states, every state is kind of taking a different approach to it. And everyone is at different levels. Like when I look at, my family in the Southwest, they're kind of at the stage where we were like 3 weeks ago. And even then people aren't really taking it seriously. And so I know every state is like different. How are you feeling that, I guess, what's your opinion on that? What do you feel like the restrictions are versus like what people are listening to, what needs to be happening, that kind of thing?
Yeah, I think that's a major problem. I think it's, going to reflect pretty poorly on the American political system, especially compared to something pretty unified like China. Because if you shut down New York and then everyone in Florida is still partying on the beach at spring break, then it really doesn't matter if you shut down New York because it'll come back. So I think that's going to be an evolving challenge. But I guess the good news is that if it hits New York first, we'll be the first to develop immunity. So hopefully it doesn't come back. But if the virus mutates, which it has a high chance of doing, then maybe all bets are off. So there's lots of variables, and people really have to just pay attention. But there's politics involved. Different groups have different agendas as far as like activity and economics versus public health and how much you want to spend. So it becomes kind of a complex issue.
Yeah, definitely.
Tough.
Yeah. And when you guys, I think there's probably so much panic there now. Are people coming in with, milder symptoms, and are you able to look at those people versus the people that are in really, really critical condition? Like where are you guys triaging things,
I'm not in
because
the ER, so I can't answer that. But I
yeah.
do know is that they literally have a giant room, like an entire
Okay.
center, just for if they think you have COVID. So I think anyone who has like a cough and a fever just goes there. Whether you have the flu or seasonal allergies or something, you just go to this room.
Okay. Okay.
And I know they're setting up massive centers just to send overflow, like the Jacob Javits Center in New York City. They're just going to send everyone in New York who doesn't have COVID to the center to free up beds in the other hospitals for COVID.
Okay. How are you, and again, this is just an opinion question, but because of everything that's happening, not only because of the panic, but also social isolation and just a change from people's normal routines to completely a different world that we live in now. How are you thinking that this is going to play out with like mental health and that kind of area that people might be suffering from either complete panic or suicidal ideation or just loneliness, like
Sure.
where do you think this is going to come into play?
I think that's a pretty silent epidemic that no one's paying attention to. There's going to be a lot of people that aren't going to be able to leave their apartment to get their psych meds. I think loneliness and anxiety and depression are going to be like massive. Like not many people that live alone are going to be okay with this for weeks on end. On top of that, there's substance abuse issues. Like that's actually why all states, in every news conference, whenever they say stuff is shut down, they always say the liquor stores are open, because if the stores are closed, all the alcoholics are going to go into withdrawal, and like a lot of them will die from that. So you actually can't shut down the liquor stores. So all that stuff I think will start really showing up in the next week or so.
Mm-hmm.
But people I don't think will take it seriously because everyone is afraid of like the plague that's going around.
Yeah.
So it'll be interesting to see how seriously that gets taken.
Yeah. Okay. Are there any other myths that you're hearing around this that you're hoping that people will just stop spreading, or things that you're seeing that you'd like to tell people that, pay attention to?
I would definitely say like social distancing does not mean you go out to a park and sit 6 feet away from each other. It means you don't go out of the apartment.
Mm-hmm.
And that if you are at a store picking up food or drugs, then you stay 6 feet away. But you don't like have a party and pretend to stay 6 feet away, because that defeats the purpose.
Mm-hmm.
I've seen picnics of people where they are sitting like 3 feet away and they're like, oh, this is like 6 feet. And I'm like, no, this is not like, this doesn't count.
Yeah.
And then the other thing is to like avoid hoarding any of these drugs that are hitting the news. I think some politicians have been like touting them as cures for whatever reasons, and none of them are proven. The trials are like, the data is pretty weak, and all these drugs have side effects. A lot of them cause heart arrhythmias, and there's been reports of people taking them to prevent getting corona and dying of heart problems.
Oh my God, I know. I saw something about like a fish tank additive or something.
Yeah, there's so much stuff out there. And there's one medication which a lot of people with autoimmune diseases like arthritis or lupus use, called Plaquenil. And it's been getting hoarded in the last like week. And now people with lupus don't have meds for their treatment because other people are hoarding, hoping to use it. So, this is like toilet paper, but on another level. Because like you're going to cause actual harm to yourself if you take these drugs without a doctor's, prescription.
Mm-hmm.
And you're going to cut off other people that have been using this drug
Mm-hmm.
as well. So it's that we're starting to see a lot of that, and pharmacies are starting to cut down. But, that's, I think, the new thing that's starting this week that we're really starting to get worried about.
Mm-hmm. And what are some things that people can do to help you guys who are on the front lines, like healthcare providers? What is something that any of us can do to help?
Stay home. Don't hoard. Because I think hoarding is like the ultimate problem, because everyone's going through a tough time, and then like people that need food aren't getting their food, people that need TP aren't getting TP, people that need meds aren't getting meds, and that's going to cause like social problems, and then like long term that'll get in the way of like distributing other stuff. So I think just like being orderly and staying home and we have enough stuff in most, in countries like mine and yours to go around, and it'll go around.
Great. Is there anything else you want to share?
Yeah, I mean, look, at the end of the day, the data says you likely will not die and you likely will not get it. You just have to keep that in mind. Like the odds of you getting it and getting sick those are the hard odds. And if you do get sick, we live in 2 countries which have good treatment. So we can have faith in that. It's better than being someplace else. So there's lots of things to look for that are positive. A lot of scary stuff out there, which is true, but there's reasons not to lose hope.
That's great. Awesome.
Yeah.
Thank you so much. We really, really appreciate you talking to us. Thank you.
Hope you guys stay healthy over there, okay?